Hello, I'm Demetrius Kazukis at HealthManagement.org. Today we're speaking with the head of the Bio-Inspired Think Tank in the Leiden Biopark. We'll discuss team building in healthcare settings. Hello, would you briefly tell us about yourself?
Hello, welcome Dimitrios. I'm really happy to actually perform this interview with you. So I have to say that this was already your great initiative. So you reached out and you proposed it. So I'm really happy to actually perform this type of interview. My name is Aneta Schaap-Oziemlak. I'm the CEO and founder and owner of Bio-Inspired Think Tank in Leiden Bioscience Park, which is actually the biggest and the oldest science park in Netherlands. And I think from this perspective, I can also introduce myself as entrepreneur, being also part of Leiden Bioscience Park community, entrepreneurial community, that I'm super as a person, which is also important for me to introduce something, tell something about myself, that I'm super enthusiastic, dedicated and hardworking woman in STEM, entrepreneur, and I would say / agile energetic coach who loves applying 15 plus knowledge in science, but also team building and international collaboration, and applying agile to drive innovation to the next level. So that's me.
Thank you. Staffing shortages in healthcare are a global problem. What are the driving factors for these shortages? How can they be addressed?
I think that there are several problems. I think from historical perspective, when you start to think about shortage of physicians and also nursing, not only locally, but also globally, this always been sort of focal, I call it, pain point of all caregiving organizations across, I think, globally and locally. So sometimes when I think about this, let's say, possible answers, because there's no one answer, definitely there is limited physician talent pool. And you would start to think why there is limited talent pool. Is this limited physician talent pool not nurtured enough in their working environment? There is not enough education. There are not sufficient nurturing working conditions, which would help not only to attract basically the talent, the pool talent to healthcare organizations, but also maintain this talent within these organizations. So I think this would be one of the answers. And of course, Corona time, which we still, I think, are witnessing still, intensified only, I think, this problems in the gap, in the service also delivery gap. If you think in that perspective of healthcare or caregiving organizations and talent. And what I also think, there is also challenging times for leadership here. It's not about talent, but also leadership in healthcare organizations, where I believe myself that there has to be done some kind of transition in leadership from leadership perspective. So leaders, their mindset and how their mindset and their vision is aligned or introduced successfully to healthcare organization and the teams and all employees which work there. So I think that's that is another problem. And how this can be addressed, I think one of the things which I very much would appreciate, because I know that this is this change, starting from leader, it can be very challenging itself for organization, because it's not so always easy to just change the leader or change the leader for the next leader. I think that could be the easiest answer, which is adaptable and flexible, which listening to employees, to their point of view, to their struggles, daily struggles, and so on, or to simply change the leader's mindset. And I think here applying agile way of transition, which is learning by doing in stepwise process. So step by step could very much help. So this also could be the answer about applying new team building techniques to make environment more nurturing, to bring more possibilities how we can now nurture our talent and how we can maintain talent within our organizations, and now how we can think about leadership in healthcare organizations, how we can actually bring leaders which are listeners and not necessarily only driven by their own personal vision. So I think this is something which I would bring in. I think the answer could be even longer, but since we have limited time, I think I will stick to this possibilities, how we could address it. Yeah.
Regarding team building, how should a caregiver team be constructed? What would be a good team size?
Yeah, so if I referring to my previous answer, where I said that about introducing agile team building techniques to build better work environment in healthcare organizations. I think if you think about the teams now, if we would like to introduce agile indeed and build agile teams, then the team size in average, when you think about already established agile organizations, from my perspective, also this is maximum 10 team members per team. So these are very small teams because you need to give sufficient attention to each team member in order to actually bring them to agile team, because each of them needs to be transformed in a way if they never had before experience with working in agile environment. And now we would like to make from this team agile team to make their environment or make better environment for them, basically.
How should the individual team member skills match that of the entire team? Should they be redundant? Should they be complementary across the team? How are the responsibilities and accountability be distributed across the team?
Mm-hmm. I think if we would think about ideal team, medical team or healthcare team, I think it's very difficult to, if you think about realistic environment, what would be possible in reality. Of course, I would not expect that team members now have to become agile and redundant, so they can basically fill up all the roles of the other team member. It's almost sort of multidisciplinary team members. I think in healthcare, that's a very inefficient process itself, if you think about personal development. So I think to answer this question, I would refer to the skills, but in terms of focusing on the skills which are directly related to, I would say, skills which normally could account and were described to lack of the skills was described to become huge dysfunctional problem. So I'm a little bit answering it from different perspective. I'm now thinking about the skills which lack broad dysfunction. And one of the important books, which actually were one of the first books for me when I start to think about implementing Agile framework in my collaborations and workshops, was a book by Patrick Lencioni, which actually describe 5 dysfunctions, main dysfunctions of the team. And the title is 5 Dysfunctions of a Team. And the first, I think the most important dysfunction, so if we translate it now to skill, is a trust, having trust, being trustful team member. And I think in healthcare, having high trust beside high-paced performance, I think is as important. So I think this could be very, very important skill, developing trust in the team, but also being as an individual team member, the same time vulnerable. And I think for people, it's generally very difficult to show their vulnerability. And I think this is something which you need to work on as a person. So this is a huge important thing for personal development for each individual team member. And the other thing is when we think about skills, and that was for me quite a big surprise to actually find out from my short research that almost all medical errors can result from poor communication, are very often resulting from poor communication. So I think communication skills are extremely important for a team or within a team. And if you have poor communication, probably also the trust goes down because you communicate poorly, you miscommunicate, people start to understand, well, you are communicating to me things which are not really trustworthy, so I don't trust you anymore. So based on this personal communication between team members, if we have poor communication, we will also have a very limited trust. And I think then the team might simply collapse very quickly. So I think that's one of the more important, if we think about the skills features. The second feature is fear of conflict, being assertive as a team member in Agile team, being able to actually bring challenges of daily healthcare related to patients is very important to share within a team. And I think we should not, as a team, also each of us should not be afraid to actually communicate not only well between each other, but also communicating our challenges, which we have definitely in the healthcare. Then it's lack of commitment. I think this comes of being engaged as a team player. I think this is also engagement skill or motivation, how we can build motivation. And of course, our leaders, we should think, okay, maybe our leaders should take here, let's say, take responsibility of providing and building motivation and commitment. But I think team itself, if it is truly Agile team, can build this level of high commitment between each other. But commitment also can be very individual. You have people which are very, let's say, purpose or goal driven. They can be inspiring to other team members. So within a team itself, you can have strong motivators or strong motivation builders. And I think these people need to be kind of nurtured, because this can be great in, let's say, communicators between leader and between team. Then accountability. I think taking responsibility for its actions, I also take as a personal skill. However, if you think about the team, this accountability is also not only taking responsibility, but also feeling as a team, especially in Agile teams, that really happens that each of us is part of solution, or each of us contribute to final decision making. And this is something which also builds this accountability. And so this is more, I would say, skills which we look as individuals, but we also grow as soon as team also become Agile team. Then it's very often discussed in attention to results or to details, which I actually call more a personal factor of the team. Well, our egos can bring us to the top as individual person, but if we want to build successful team-oriented organization or healthcare organization, we need to think about the team and about the patient in the end. So I would say team focus is here very important, rather than your personal success or ego and career, really career which you want to develop. So definitely this personal factor that I do it as a team member and in order that my team will reach success. This way of thinking, this way of team-oriented mindset is extremely, especially crucial in the healthcare, where teamwork is really necessary, especially when you have high pace requirements or demands. So that would be I would say, the answer related to skills.
What metrics should be used to determine the effectiveness of a caregiver team? How should the metrics be used to identify improvement areas?
Mm-hmm. So metrics are important for organization, for leader, and also for the team. And I think these are three, let's say, players which have to make sure that metrics are indeed performed. If we think about what type of metrics, you could think about, of course, qualitative metrics and quantitative. And I think that's very general, which I think a lot of people would already think like, yeah, this is indeed something which need to be taken place. But now the metrics from leadership perspective or perspective leader can be definitely different, because leaders usually want to get the metrics, let's say, done on their table, let's put it that way, and simply see the results of all this metrics, which have been analysis have been done. But I think from perspective of a team, each team, what I also experience is very different, and teams, they, for example, could expect that metrics in agile environment, the time for delivering metrics to the leader is important. So I think this is good that team understand that, but team can, as an agile team, could think about defining their own metrics, especially in terms of quantification. They can actually think in which way we want to determine, for example, level of trust in our team, level of commitment, level of responsibility, a level of service quality which we deliver to the patients, and also communication skills, which I already told you before. So I think let's say qualitative vision can come from the leader's perspective. Leaders can give a team basically requirements. These are the type of metrics I would like to see from qualitative perspective, but from quantitative perspective, how this is going to be measured can be defined by the team. And if the team is not actually really aware enough how to measure it, I think agile coaches, including me, can be very helpful as a support to establish, let's say, quantitative measurements and help the team. I think that's where agile coaching can be very helpful and very practical.
Thank you.
Mm-hmm.
How can an organization promote a work culture that respects coworker dignity and promote engagement?
Mm-hmm. So we all, of course, if I would imagine myself working as a healthcare employee, I would like that my organization, from perspective, I'm bringing up perspective, bottom-up perspective. I would like to be, first of all, understood, listened to. I would like to also have, as a part of the team, me as a team member, I would like to, from time to time, also hear and actually have some gratitude of the work which I do for patients. So I would like that organization itself is promoting a team-oriented or team-nurturing culture, where team is brought as the top value for the organization. Teamwork is brought as a top value, and everything around the team. So all the support which a team could be offered is also very visible, because sometimes the support for the team is not well visible. And if there is no support for the team, and you think from perspective of collaborative effort, which happens in medical environment, where the effort is brought by service providers, care providers, but also patients. Even we sometimes think these are the end users. I think the team members' support for teams need to be there, need to be visible and well understood. So this is one thing. How can medical organization promote a work culture that respect coworker dignity and promote engagement? Because if the healthcare employees from both are listened to, and they have time to, let's say, find support, quick support for their challenges, they feel needed. They feel also, they feel rewarded That's another thing which I already would like to bring again. They're rewarded for them for their great work as a team. That also brings great engagement because they feel important. I think that's they feel that they matter in the organization as a team. So yeah, this is something which I think a lot of organizations need to understand and promote by also adopting policies to it, what I just said about, that the policy is also employee friendly policy, and again, not policy which doesn't serve anybody.
Can you elaborate on strategies to promote healthcare worker safety, mental health, well-being, and prevent the healthcare worker burnout that we see today?
Mm-hmm. I think there are strategies, and I think well-being, indeed, well-being and mental health is something which we need to also not only give general possibilities to the team-oriented organizations, if we would think about agile organizations, but also not non-agile yet medical organizations. I think bringing well-being strategies is extremely crucial for daily high pace, as I said, high performance of each employee, each healthcare employee. And of course, from perspective of employee, again, if I would be this employee, of course, each of us could find a way, well, in our busy time schedule, in the end, maybe in the late evening, that we could, for example, participate in some activities, sport activities, or find a way how for ourselves, how we can bring well-being to our personal life. But as I said, if we think about organization and well-being of organization, this is well-being of each team. So it's not only individual should take action and think how we can how I as an individual can take care of my mental health and well-being, but also how as a team we should think about this. And I will bring something from my environment, from the business ecosystem in Leiden, with one of the global pharma companies, which is actually focused on patients and developing innovation for patients. This is actually a global pharma, Bristol Myers Squibb. And they decided, even they also work very intense in very intense way for global basically improvement of patients' quality life by developing innovation. They organize, for example, their biking team. But I would not imagine MDs, let's say, getting on the bike and bike at the same time. But definitely, this is just example that this could be sport, any sport activity, and thinking easily, this could be even, I, for example, would introduce power yoga classes or yoga classes each day for the team. So the team takes some sport activity, which brings some endorphins, as we know, some good endorphins, which are good for well-being of the team, and doing things together also helps to well align this team at the same time. So not only bringing well-being, but more you train together, more your mindset is also sort of adjustable and flexible to feel like we are one team and we can do basically everything what we have or what our challenges are. So this answer can be as simple as that.
Thank you. Regarding diversity versus homogeneity in a team, how does diversity benefit performance? What problems does it eliminate?
Mm-hmm. I think if we think about, I would say, healthcare service chain, so what happens when patient comes and what happens afterwards, you would like to have a team which is cross-functional. So there are people which may have different background, or they actually are at the different points of the service. I call it chain or workflow, because this helps if you have these people from very different background or different let's say different people or different positions where they feel different part of this I would say healthcare service. these people would start understand how the global work flow process of healthcare service works for patients. And in that case, you would create sort of self-awareness. So diversity would help to increase self-awareness about each different type of role, each different, I would say, caretaker is responsible or performs. That could be one thing which I was thinking of. From the other thing, when I think about diversity to bring better performance, because the self-awareness or this knowledge about other people function and role which they have to perform or do or execute is better. If I always have this diversity, when I think about diversity, I also think about, diversity in terms of gender. And I know that this is more relevant to inclusion when we think about gender, but from my workshops, which I perform as a coach, I noticed that if you bring element of diversity, which some people may define, maybe that's more inclusion, but still you, instead of building men team, you build or woman team, women team, you build mixed team, so men, women team. So in that case, you bring some diversity, gender diversity, because you don't have only men or you don't have only women which are working in a team. And what I actually experienced from this Agile workshop, that actually bringing this diversity in terms of gender actually improves the performance. And that's something which I observe, which I observe as a coach, and which was the fact by performing this workshops. So I think this is something very interesting to dive into it, because definitely when we think about the gender gap, maybe that also can be relevant to diversity, not only to inclusion. And also building better performances.
I was wondering if you can elaborate on what you mean by the self-awareness.
Self-awareness, yeah.
So you mentioned that the diversity can create better self-awareness among the team. I'm trying to frame my
No. I talked about self-awareness in this perspective that. If we have, for example, only hematologists, and we make a team, one team consisting only from hematologists, we might miss important factor, because maybe we should also introduce nurse. Maybe we should introduce, let's say, another stakeholder. So that's what I'm trying to envision here.
We are eliminating groupthink.
Yeah.
Okay.
So that creates a different way of thinking. It even creates, if you would think, maybe we should not only bring a hematologist, nurse, another different, let's say, or even this could be leader also. Maybe this could be leader of the department. Or head of department, but we can also bring maybe other clinician. Maybe we should bring a chemical clinician to the team. So this different perspectives, still related to patient in the end, how to improve quality of patient life, brings different people to the same team. And what I also sometimes see, there is a very big, also what a lot of health organizations, but also clinicians, which are developing innovation, they become entrepreneur, developing innovation for patients, bring, is that there is a very big or very difficult communication between the healthcare as organization, but also the insurance regulatory part. And I always wondered if we should not include it also in the process, because in the end, this is also, let's say, important stakeholder, which is contributing to the healthcare organization, even it acts externally still. So I'm talking about very diverse cross-functional teams in this perspective, because then these people understand, for example, clinicians start to understand what are the pain points of the nurse. Nurse understands what are the pain points of the leader. So we start to understand what are the, let's say, challenges for each of us from different perspective, from more top perspective, bottom perspective of the insurance companies, perspective of regulatory. We start to understand like a global chain, basically. I call it chain, work chain, which brings in the end a solution to the patient.
Thank you. What technological solutions are available to help teams in healthcare settings come together and collaborate better? How can they help?
Mm-hmm. So definitely, I would say here, and maybe that's not the answer you expect, bringing agile way of transition. If we think about, let's do it agile, let's nurture and change organizations to nurturing, applying agile. That this has, agile is more about learning by iterative process. So if we didn't yet accomplish agile transition for healthcare, which I think from my perspective, this process never occurred yet. There have been a lot of agile transitions in different organizations, but I think healthcare organization as a type of organization is the most challenging organization to perform these changes. So I think short answer is we should first apply this transition in real time before we move to make it digital transformation or digital transition. We have to work it out within a particular system without yet moving to digital type of transformations. And that's why I would like to leave this question a little bit as an open end, because digitalization might not necessarily be only thought about the type of communication which we could introduce. That's what I could share, maybe the secret, but it could also mean something else.
So if I understood properly, a lot of your position is that that the industry itself is not ready yet to move to technological solutions to implement agile strategies. No,
industry is ready. Industry is already doing it, but the healthcare organizations, if we think of in perspective,
that's what I meant. The healthcare organizations are not ready yet.
Yeah, I more define here healthcare organization as a hospital, medical centers. That's for me healthcare organization. They are not even. I think they not even think yet about this. While if you think about industry, and I just mentioned American pharma, they are already implementing it in their work culture. So they are already busy with the process. But medical centers, university medical centers, they are not there yet, because the vision of the leader is different. Very often the vision of the leaders is not focused on team-oriented work culture or collaboration. And I think that's where the biggest difficulty is. And also I talked about communication. That's also something which also brings a leader of the health organization, in that case, leader of university medical centers, in challenging position here.
Okay. So to make a long story short, they need this needs to be addressed first before implementing any technological solutions that will facilitate agile strategies.
Yes, and I think, what I realized, Dimitrios, from our conversation, that we also should maybe at the beginning define what is healthcare organization, because for me this means university medical centers or hospitals. That is something which I think is more for me to be focused on here.
Right. I mean, I would add into that outpatient clinics and any
the clinics,
organizations that house them.
Yeah. If we, as I said, if we think about university medical centers, they are not ready yet. But if you think about pharmas, American pharmas, because they are more fast forward, they are already in the process, but they are also not yet, because the thing is that these organizations are, it's not like we have the finest version. Well, maybe we have the finest version of organization now, but now we maybe suddenly we'll have more challenges and we have to adapt again. So it's a very iterative change. And I think that's what makes it so interesting, because it's like building your experience in time, and every time learning something new, and every time sharing something new.
Right. So I'm going to add the qualification that this is in terms of the Agile process.
Yeah.
Because healthcare digitalization is happening as we speak.
Yeah,
Right.
it does. But as I said, in maybe personal communication, but as a whole organization, it's like these are like two. You would write two separate books about this. Let's put it that way.
Okay.
I would say very big textbooks about this. I think that's why, because Agile is more learning by doing. You have to do something, then you know what is the result in relatively short time. Then okay, this worked. Now I go further. I move on to the next challenge.
Mm-hmm.
So it's a real multi-level learning process, where every time you learn in short time something new, and then based on this knowledge you build level by level more knowledge about the transformation or about the change. But of course, ultimate goal should always stay the same from the beginning till the end. Mm-hmm. Because otherwise, if we would lose goal, or we would not define well the goal at the beginning, we would lose everybody in the process.
Right.
So this goal of transformation, why we do it, what kind of organization we want to become, in that case, nurturing organizations, because we want to not only attract healthcare talent, but we want to maintain it if we have indeed shortage of medical staff. But now, how are we going to maintain it? How are we going to not only educate them, but how are we going to actually nurture their work environment so they can perform at best? So this is in the end the goal, I would say.
Yes. Well, thank you, Aneta. I want to thank you again for taking the time to speak with us. Mm-hmm. To talk about team building.
Yeah.
And we hope to have you again soon on HealthManagement.org.